Live from Hollywood, this is the KTLA Morning News with Carlos Amezcua, McKenna Pereira, Mark Krisky, Sam Rubin, and the entire KTLA Morning News team.
10 things men should know about plastic surgery.
Absolutely.
Gail breaks it down and then builds it back up for us. Coming up next.
I'm Gail Anderson in Beverly Hills. Our Tuesday torso tune-up. Sure, women think nothing of having a little plastic surgery, but now men are doing some things. We'll tell you the 10 things men should know about plastic surgery in a live report.
Also, 10 things men should know about plastic surgery. Gail's got it.
I just want to know one thing.
What?
Just one thing.
What do you want to know?
About plastic surgery.
Yeah, tell us one thing.
Tell us one
I'm
thing.
going to tell you
10 is too
10 in
many.
a few minutes, but he looks pretty good is one thing. We'll explain when we come back in a live report.
Hey.
That looks nice.
It's time again for our Tuesday torso tune-up. Today's topic, plastic surgery for us guys.
For you guys. We have 10 things that men should know about plastic surgery. Gail Anderson is live in Beverly Hills with more. And you know what? The 10 things are good, important things for the women in their lives to know about as well, isn't it, Gail?
Exactly. It's stuff we can use too. But a lot of guys don't know this because they don't do a lot of this. Women do this more than men, of course. Dr. Lloyd Krieger, we're in his offices here in Beverly Hills, and we're with two of his patients, guys who decided to do this. Patient number one is Mike. We're all numbering candidates this morning. Patient number one is Mike. Amazing results. Let me show you his before. Dr. Krieger, Mike had a little pot belly, should we? Just to be nice, is that what we want to say?
Michael was overall in good shape, but he did have a little extra in the middle, which he was not able to get off in the gym. I mean, he worked out very well.
Now look at the side view of this, again, before and after. Wow.
It just sort of settled in the belly and on the sides and in the chest a little bit, and sometimes even going to the gym won't work without massive weight loss. And so for Michael, we helped him by doing some liposuction on the belly and the chest and on his two sides. And he followed up by going to the gym very regularly and really took it to the next level and improved upon the surgery that we did for him.
Michael, how much of a difference did this make in your weight?
Shortly after I had the procedure done, I was 20 pounds lighter.
Whoa! Now, can I do an unveiling here? Sure. The interesting thing about Dr. Krieger's work, we were with him for Tummy Tucks for Women. They look even better in person after the pictures. And I'm just going to pull your shirt up here. Look at you.
Yeah, he's nice and smooth.
Ooh, it feels firm. Of course, it's been a while since I touched it. But, wow, are you pleased?
Very much so, yeah. Yeah, absolutely.
All right, let me explain to you where we are. Again, we're at the offices of Dr. Lloyd Krieger here in the Rodeo Collection in Beverly Hills. And we're learning 10 things men should know. Problem with men, we'll go through our list next hour. One of the problems with men, they're big babies about this.
We got to work with men. We got to be real careful with men. Not a high pain tolerance, not good at following directions.
Okay, was that true, Michael?
Except for Michael.
I think I was a pretty good patient.
All right.
Michael was a great patient.
Byron is over here waiting in the wings. We're going to show you his procedure and results next hour.
Can I be a voice of reason?
Yes.
They look good just the way they are. We
Well,
love
sure,
them
they both had
anyway.
plastic surgery
There's
already.
more of them to
Did you hear that,
love.
Michael?
I did, thank you.
There's more of you to love.
Gail, can I be a voice of unreason?
Yes.
Can I ask the doctor a question quickly?
Yes, he can hear you.
No, next hour? Okay, we're out of time. I'll ask the doctor a question of unreason.
Sorry.
Can't wait to hear what you're going to ask.
I'm Gail Anderson in Beverly Hills in the offices of Dr. Lloyd Krieger. We're learning 10 things men need to know about plastic surgery. One thing, men find his patient is women. Is that a girl? Ooh, details in a live report. Is that a girl?
All right, more and more men are going under the knife.
Up ahead, Gail has 10 things the fellas should know about plastic surgery. I think she's just coughing a feel, frankly.
Up next, 10 things you should know if you're a man about plastic surgery.
Yep, it's gonna hurt. Is that it, Gail? Is that number one?
Sure, there'll be a little discomfort. We're in the offices of Dr. Lloyd Krieger with two guys who've had some procedures. The one important thing is that guys should go after subtle changes. If you do anything dramatic, I'm learning that surgery could make you look more like a woman. Not a good thing for a guy. I won't explain when we come back.
It is time once again for Tuesday Torso Tune-Up. Today's
This has
topic.
nothing to do with my torso tune-up.
Is this your chin?
I think I want a little bit of chin removed here.
Carlos and I want a double. Can we get a 2-for-1?
Yeah, can we?
You should be careful. Dr. Krieger can hear everything you're saying.
Hi,
Isn't that
doctor.
right, doctor? He can hear everything you're saying. What we're doing, we try on Tuesdays, for folks who know this Tuesday Torso Tune-Up, is to take a look at some of the new procedures that are going, and the new things that are going on in plastic surgery. And one of the new things is the fact that guys are getting in on this. Having said that, we have two of Dr. Krieger's patients here. One of them Byron, one of them Mike. We looked at Mike last hour. I'm hesitating because I have an evil thought. He had like a little pot belly, kind of like somebody who works in our office, but I'm not going to name names because I need this job. But it's gone, you know, where your pants are down below your tummy. Anyway, and then Byron, what did Byron have done, Dr. Krieger? Now, we're going to show your before picture. Is that okay, Byron?
Yes, that's fine.
Okay, here we go. Here's your before picture.
Well, Byron, you were in the military, right?
Yes, I was in the military. I had that problem before. I mean, after I got out of the military, then I just went straight back to my size, large
so he
size.
got a little softer after he left the Army,
Yes.
and he came in, and what we did for him just a week ago, exactly, in fact, was a liposuction.
Yes.
We took out quite a bit of fat
All right, now,
from his
Byron,
chest and belly.
you don't mind if we show. Now, this is post-op, right? Yes. This is what guys will have to go
This
through.
is
Go ahead.
immediately post-op.
Now, I called it a girdle, but that was so wrong, right?
That's just a bandage.
We call it a binder, an abdominal binder, and what this does is it helps to, after we suck out so much fat, we
Sorry,
need
Byron, that you put it like that.
we need the skin to shrink so that he has a nice tight contour like Michael has now. And what we do to help that along and speed it up and get an even better final result is we put him in this pressure garment that helps push the skin nice and tight and help nature along quite a bit after the surgery.
Okay, and so that people will know where he will be headed, we've got Michael here who's had a similar procedure done. Mike, show him how good the... Wow!
Michael's nice and flat, and you can see that the liposuction and then those garments really did work to make things nice and smooth. He's very tight.
And then we want guys to know who are, we're talking about 10 things they should know. One thing, another thing they should know is that doing this lipo is not going to give you Arnold Schwarzenegger abs.
It's really not. And what Michael did, which was so fantastic, was he used the surgery as a springboard to go off to the gym. And Michael really worked out and got himself together, and we gave him a great result, and he made it that much better by working it with a trainer and regular trips to the gym.
How much does a regular liposuction like that cost? Not that I would want one, but I'm just curious.
The total price for a liposuction, it depends on how much we're doing and how many areas. It could range anywhere from $4,500 to $7,500 or $8,000.
Doctor, very quickly, myth, fact, or fiction. I hear that there's some people who say the body likes to store X amount of pounds of fat. You remove it from the stomach, and all of a sudden people end up, getting fat in areas on their back or on their shoulders, or areas they don't. Is that fact or fiction?
That's fiction. It's a great question because every single person asks that. What happens is when we do liposuction, we remove it from areas where it's exaggerated and prone to excess. And after liposuction, if you don't gain weight, no fat will come back. But if you do gain a little weight, it'll come back much more evenly distributed and not in an exaggerated way, like it would have on Michael, for example, on his chest or his love handles. So it does not come back in funny areas after liposuction. It's not something you have to worry about.
Doctor, I've always heard, and they say that people are reticent to really talk about this, that people minimize how painful it is, that it really hurts, particularly post-op. Is that true?
I'm going to defer to the guys, and they can answer that. I mean,
it's more discomfort for me. It's just been a week, and I was working on my car. I mean, a couple days afterwards, it was just more of a discomfort pain. It wasn't like a serious pain that you would see usually on the other people.
As part of the procedure, we put in a long-term painkiller that lasts for about 2 or 3 days after surgery, and that does really tend to help for that first overall part of the recovery.
You put it into the area you did, or is it in the prescription?
Well, people do get prescriptions for overall pain relief.
But you actually
as part of the procedure, exactly.
Wow.
We infuse a solution throughout the area that we work that coats that entire area and minimizes the pain.
If 3 of us go in at once, do we get a deal?
Gail,
KTLA.
Yes.
did you notice how many questions the guys had on this one? You noticed that, right?
Oh, yes.
I had nothing. I had nothing.
Doctor, if you're doing the liposuction on 3 of us, do you have like a 40-gallon drum there?
What? Okay, wait. Here's where we are, because I know you guys have a lot of questions, Michaela.
Oh, yeah.
This is where we are in the offices of Dr. Lloyd Krieger here, the Rodeo Collection, Beverly Hills website. You can also go on the website and see more of the 10 things guys should know about plastic surgery. Gentlemen, thank you so much for sharing your procedure with us. Thank you for doing that. And Dr. Krieger, thank you as always for putting up with our anchor questions.
Oh, no, we love it. Thanks very much, Dr. Krieger.
Thank you, Gail. We'll be back in a moment. No, seriously, if you drive, you can pick the other two up.
Make it in the neighborhood. They like the smell of it in Hollywood. How could it hurt you when it looks so good? Shine your light now.